Welcome to this channel. Myself Dr. Debnath. My laptop is not working, so I am making videos on the iPad only. So you will be unable to see me, but it will be very interactive or very interesting subject, that is psychopharmacology. In psychopharmacology, before going to the drugs, we need to understand what is psychosis, what is schizophrenia. Remember, schizophrenia is psychosis, but psychosis does not mean only schizophrenia. So schizophrenia is a part of psychosis, is a one kind of psychosis, but once there is psychosis, it can be substance induced psychosis, it can be delusional disorder, it can be psychosis due to general medical conditions. So the message is all schizophrenia are psychosis, but all psychosis are not schizophrenia. Now in schizophrenia, we will talk about in 5 domains, that is positive symptoms, negative symptoms, cognitive symptoms, aggressive and affective symptoms. Now in positive symptoms, that is are added to the subject, that is delusion, hallucination, disorganized speech or behavior जो कि normally नहीं रहता है, it's added. That's why they are positive symptoms. Remember, the most important pathway related to the positive symptoms is mesolimbic pathway. That is very important. That means mesolimbic dopamine pathway will give you the positive symptoms. In negative symptoms, if you see alogia, affective flattening, asociality, anhedonia, evolution, this all comes under negative symptoms. And most important pathway related to negative symptoms is mesocortical pathway. Now, cognitive symptoms, it is dorsolateral prefrontal cortex. Affective symptoms, it is the ventromedial prefrontal cortex. And aggressive behavior is because of the orbitofrontal cortex. So this is all about pathway. We'll talk about the neurotransmitter and how this neurotransmitter act on this pathway and cause symptoms of psychosis. Now, neurotransmitter, if you talk about in schizophrenia, we should talk about dopamine, glutamate, and other neurotransmitter. In this video, I will talk about only dopamine. So, in dopamine, we will talk about how dopamine is synthesized. Number 1. Number 2, what are the dopamine receptors? And number 3, what are the pathways? So, we will talk about dopamine. Dopamine actually produced from the tyrosine, by tyrosine hydroxylase in DOPA. The DOPA get converted into dopamine by DOPA dehydroxycarboxylase, DOPA decarboxylase, and they get stored in the presynaptic vesicle. Now, if there is excess dopamine, it will be destroyed by the MAO A or MAO B if it is within the neuron. If it is outside the neuron, it will be destroyed by the COMT, catechol O-methyl transferase enzyme. Now, in the receptors, there are 5 important types of receptors, but most important receptor related to psychosis is D2 receptor. D2 receptor. No, we know any kind of dopamine increase in the pathway will cause psychosis. Okay. Now, decreased amount of dopamine is usually seen in case of Parkinson disease. So, in case of Parkinson disease, we will try to increase the dopamine by using the agonist of dopamine, that is D2 agonist. We will use, there will be increased amount of dopamine and it will be helpful for the Parkinsonism. But if you talk about psychosis, dopamine is already excess, so we need to block the dopamine to act on the D2 receptor. So we will use antagonist of the D2 receptor, so there will be decreased amount of dopamine and we can use for the treatment of psychosis. Now, what are the dopamine pathways? These are very important. Remember, there are 5 pathways where dopamine acts and cause psychosis. Number 1 is the mesolimbic pathway. We already talked about mesolimbic pathway. We'll talk about in details of this mesolimbic pathway. Mesolimbic pathway starts from the brainstem of the ventral tegmental area and it goes to the ventral striatum, that is the nucleus accumbens. This pathway is very important for the positive symptoms, also important for the motivation, reward system and pleasure. This is very important because in the later slide we will talk about this, why addictions are more common in case of schizophrenia. If you see schizophrenia, there will be increased amount of drug abuse, especially the nicotine or vice versa also. The mesolimbic pathway is also important for the aggressive and hostile behavior of the subject or the person. Remember, any CNS stimulant, especially the cocaine and amphetamine, they will increase the dopamine. Once there will be increased amount of dopamine, there will be psychosis. So in case of psychosis, we need to rule out whether the patient has taken cocaine or amphetamine or not. Mesolimbic pathway, we know that is the mesolimbic pathway, we know it is the dopamine, and we know it is related to the positive symptom. So in details we'll call it as a mesolimbic dopamine hypothesis or positive symptoms of schizophrenia. Similarly, the mesocortical pathway, which is important for the negative symptoms, which is important for the cognition as well as the affective symptoms, here ventral tegmental area to prefrontal cortex. Now, prefrontal cortex is two parts. One is dorsolateral DL, dorsolateral prefrontal cortex. One is ventromedial prefrontal cortex. That is medial, that is related to affect or emotions. If it is dorsolateral, it is related to the executive function. It is related to the cognition. That is very, very important. We need to remember, because whenever we talk about the drugs and where the drugs will target, and it is important to know. The mesolimbic pathway is also important for the reward, and it is also important for some of negative symptoms. Now, how to support this hypothesis? Now, we have seen if we use typical antipsychotics, that is typically block the D2 receptor, there will be worsening of the negative symptoms. Usually negative symptoms are because of the mesocortical pathway. In mesocortical pathway, when dopamine is reduced, there will be negative symptoms of schizophrenia. But if we use typical antipsychotic, it will block the D2 receptor, it will block the dopamine in the mesolimbic pathway, and that also worsening the negative symptoms. So negative symptoms, there is a role of decreased amount of dopamine is mesolimbic pathway also. And remember, decreased dopamine in the mesolimbic pathway, there will be decreased reward, there will be anhedonia, so patient will take drug abuse. So substance abuse will be more in schizophrenia. Another important pathway is the nigrostriatal pathway, is substantia nigra to the basal ganglia or stratum. Remember, it is the extrapyramidal nervous system pathway. Extrapyramidal nervous system pathway. So extrapyramidal symptoms are because of the nigrostriatal pathway. So if you want to control the extrapyramidal symptoms, we need to focus on the nigrostriatal pathway. So I am repeating, before going to the drugs proper, we need to understand the psychopathology, and so that we can target it better. Now, nigrostriatal pathway dopamine is related for the responsible for the movement. That is, if there is decreased dopamine, there will be Parkinson-like features. So there will be Parkinson-like features, tremor, akinesia or bradykinesia. Now, if there is chronic blockage of D2 receptor, there will be hyperkinetic movement. We call it tardive dyskinesia. Tardive dyskinesia, where there is chronic blockage of D2 receptor. Another important pathway is the tubuloinfundibular pathway, where hypothalamus to anterior pituitary, that is very, very important. As we know this, normally it will inhibit the prolactin release. It will inhibit the prolactin release. Now, if there is any disruption of the circuit, there will be increased amount of prolactin. There will be increased amount of prolactin, which will cause ultimately galactorrhea, amenorrhea, and sexual dysfunction. And another important now upcoming pathway is the thalamic dopamine pathway, where it is related to sleep or arousal. Remember, thalamus is important for the getting mechanism. Important for the getting mechanism, that is the information thalamus receives does not pass all the information to the cortex or the higher center. Rather, it will get or it will filter out some information which is not very important or necessary. So we can think properly. Now, in schizophrenia patient, the thalamic getting system get impaired. So all the information goes to the cerebral cortex or the higher center. So there will be disorganized behavior or disorganized speech. This all gives you the psychosis. Remember one thing, schizophrenia is a psychosis, but all psychoses are not schizophrenia. So this is the basic psychopathology of the schizophrenia, positive and negative symptoms. We'll talk in details in upcoming session. Thank you so much.